All right, let's go ahead and get underway. I'm excited today. We've got a lot of great content for you, and we're super excited to have a very talented youngish man to deliver it to us. So I would like to introduce everyone to Stephen Watson. He prefers to be called Steve. Of course, that is unless he's in trouble with his mother, with his wife of 11 years, or potentially with law enforcement. Any of those things will get him called Stephen. For the last 10 years or so, though, Steve is partnering with small and medium and enterprise businesses to streamline operational workflows, to increase customer service and satisfaction, and to stabilize and increase revenue. Before he came on to Rectangle Health, he worked for two of the top 5 national banks in the U.S., delivering those state-of-the-art solutions to meet the needs of business customers and their clients. Now, while Steve's not working, my understanding is, and Steve, you can correct me on this, he's either grooming his mustache, which is entirely possible, or he'll be on his bright red Trek mountain bike in the woods on some dirty trail somewhere. Is that accurate?
Sounds about right. Yep. Now I've expanded to the bottom part of my face, as you can see.
I see
beyond the mustache.
That's good. Hey, Steve, thanks so much for holding this webinar. I'm going to hop off, and Steve will remind you about some question and answer stuff at the end, but I'll jump back on and we'll moderate that at the end. But right now, ladies and gentlemen, Steve Watson.
No, thank you so much, Frank. Very excited to be here as well, to be able to speak on this subject that is truly near and dear to my heart. We'll spend part of our time today talking about the unique challenges patients are facing when identifying healthcare affordability and how that affects practices that they're trying to deliver the unique care for their patients. We'll also talk a little bit about the inspiration for creating Care Now, Pay Later, the benefit to your practice and patients, and then dive into how the Care Now, Pay Later program works. Lastly, as Frank just mentioned, there will be some Q&A at the end, so please utilize your chat box to queue your questions, and we'll definitely be able to answer them with some time left after today's discussion. So let's go ahead and talk a little bit about who Rectangle Health is. At Rectangle Health, we believe if the practice has the tools that they need to succeed, their patients will naturally succeed as well. When choosing partners, we look for industry leaders that align with our vision and our mission. This enables our associates and clients to truly shape what's possible. Let's look at some trends that we're noticing when it comes to patients and payment of services to providers. So as you may see it in your day-to-day lives when you're working with patients, today's patients are facing a number of challenges, such as rising costs of basic services. When you're going to the grocery store, you may have seen that the eggs have increased from what I used to pay as 99 cents at Aldi to almost $3 or $4. They're also facing gas increases, costs for utilities and other living expenses. And quite frankly, wages aren't covering some basic living expenses. And then what's also been around in the recent news is the rising interest rates. So if anyone has a credit card with a balance due, the monthly minimum payment and the total interest accrued has quite significantly increased over the last several months. This doesn't only just strain budgets, but it makes it increasingly difficult for people to save for a rainy day. So patients are facing these challenges when they come to healthcare providers like yourself joining this webinar. They're seeking services that they know they need in order to lead healthy lives. But if the patient has insurance and there's a remaining balance, there could be some challenges for them to afford that care for one reason or another, which could result in patients delaying treatment and ultimately payment. So what happens at a practice when it comes to paying for service? Well, more than 30% of patients leave a medical practice without paying anything, and they're 50% less likely to pay their bill once they leave your office, which means 70% of medical providers report that it takes 1 month or longer to collect from a patient. And in many cases, that leaves that bill unpaid for 60, 90, 120 days and beyond. So many of you on the line today may have experienced or are currently experiencing one or many of these scenarios listed on the slide. What could you do with the additional time that it takes to call patients to pay their balances due, or access the additional capital if 10% more of your patients paid their open balances before they left? Keep those questions in the back of your mind as we go through today's conversation. When a practice is able to accept payments online, or through electronic billing, effectively, your practice is now officially open 24 hours a day, 7 days a week. This means that this is an employee within your practice that doesn't need holidays, doesn't need vacation time, and never gets sick. So as technology advances and becomes simpler to use and is easily accessible, patients are looking to take advantage of all those advancements. So they can skip the phone calls and in-person trips to make a payment on their accounts, and they can fit the activity of paying their bills or paying their balance dues into their schedule on their terms and quite frankly, without judgment. Trends in other industries can also have a direct effect or influence on the healthcare industry. So healthcare, as you all may have noticed and through your experience, it's become more expensive than ever. Patients continue to be responsible for more out-of-pocket costs that were traditionally covered years ago. Now, an even greater number of people are lacking coverage altogether. Treatment that at once was a no-brainer in the past and was able to be budgeted for. Now, many of these patients have to take a hard look at their budgets and make that decision. And are we going to buy food this week, or am I going to get the treatment that I need based on the conversation I had with my provider this week? And the most concerning part of all of this is the avoidance of care, right, that we just mentioned, which can ultimately lead to higher healthcare costs because people are forgoing the treatment for that mild condition that was identified up front. And now that the time has passed by, the condition has possibly become more serious, which ultimately leads to more costly treatments. So let's take a look at how retailers are helping their customers with purchasing goods and services. Often, like I mentioned earlier, healthcare is influenced by trends in the retail sector or another industry. Buy now, pay later is actually a great example. So purchasing products today has become so simple that it's almost scary because I can literally pull my cell phone up and have something delivered to my house tomorrow that I may have in the past had to actually physically go to the store to buy, or not able to buy it and have to wait several weeks for it to come. But you know, again, purchases can be done as little as 3 clicks at some points. Traditionally, if a customer didn't have the cash to pay on hand, they would maybe use a credit card to make that purchase and then pay for it later. Or they might open up a new credit line, like a credit card with a 0% interest rate, which would result in a hard inquiry on their credit. Now, as you're preparing to check out on your favorite retailer websites, most recently ours has been Macy's, as we're doing some additional home shopping. You're not only being presented with the total cost of the product or service, you're also being presented with the ability to pay over time. Not only can you select a budget-friendly monthly payment, but you can also feel good knowing that repayment for this purchase has an end date. Where if they use the traditional credit card in the past, they're on the hook and responsible for understanding when that balance needs to be paid off without accruing any additional extra penalties and interest. Pretty simple way to make purchases, and you can see this option at every major retailer these days. 2 of these stats here, though, actually really jump out at me. The first one is the 60% of US adults have used some form of buy now, pay later service. And then the other is 50% of US adults are interested in a buy now, pay later service. So effectively, that means there is a good chance that up to 50% of your patients are familiar with buy now, pay later. And really, at the end of the day, buy now, pay later is almost expected to be seen in any checkout experience that a patient is involved in, but also buy now, pay later is also expected to grow. So what is so attractive about buy now, pay later? Well, one of the main things is that it's easy to use, right? Paying back in installments is a convenient and easy way to fund items, especially for ones that are slightly bigger, like a couch that I purchased recently, or a pool that we actually just purchased recently. That you know, as we enjoy the summer months here where I'm located in Georgia, while I may have had the cash on hand, it gave me peace of mind that I can make those payments over a series of several months, and then also choose to pay it off early if I wanted to. But when it comes to most expensive purchases, the younger generation wants to understand the time frame of the payments, and the pay over time option allows it to fit into their budget and know when the payments are going to end, like we've said previously a couple of times. Making big purchases when cash is tight is one of the factors that also makes buy now, pay later so popular. For so many, it enables them to make that purchase immediately if they don't have the money up front to pay it. Unlike strict eligibility criteria that comes with traditional applications like with a credit card or a loan, buy now, pay later, even if you have a poor credit score or no history at all, typically you're going to be getting approved, where other lenders may turn you down. Many buy now, pay later options offer interest-free repayments. This makes it incredibly cheap and flexible way to borrow money, so you don't have to incur interest charges and still pay back the installments. You may be thinking, Steve, thank you for the short history in buy now, pay later, but how does this impact my practice, my employees, and ultimately my patients? Well, going back to Rectangle Health's mission and the increasing need for patients to have access to flexible payment arrangements, patients are looking for ways to get the healthcare that they need, and Rectangle Health is excited to bring you Care Now, Pay Later. Care Now, Pay Later is an innovative solution to help increase patient access to care, fast upfront payment to practices, and will give your practice the confidence in knowing that there is a plan for every patient you present Care Now, Pay Later to. Through our partnership with Rectangle Health and Healthcare Finance Direct, Care Now, Pay Later is a solution that gives providers the ability to offer their patients flexible and affordable financing. Patients get access to treatment that they need with a custom payment plan that truly fits any budget. Providing these options helps ensure patients seek and follow through with the care that they need and the care that you recommended them. So what's in it for the practice? Care Now, Pay Later is the only nearly 100% approval program. I'll pause for a moment, let that sink in. Nearly 100% approval. This enables your practice to present Care Now, Pay Later with confidence, and knowing that there will be fewer declinations, which if there's fewer declinations means more patients are approved and more patients walk through the door knowing that they have an option to receive treatment. The other piece of that is there's no partial approvals. You may have had an experience where previously, if you offer patient financing today, that you got a patient excited about a treatment plan. They may have not had the cash up front to afford it, so you recommended a third party. And after they applied with that third party, they only got approved for a portion of the amount that they were looking for. So maybe they applied for $3,000, but they got $1,000. Yes, that they're approved, but because it's only covering a small portion of the amount, it's like if it's almost like they got declined. So we can take that off the tables where there's no partial approvals. And then for the practice, get paid nearly in full for all approved patients. And we have the best rates in the industry, and you're paid up front 2 times a week. And lastly, there are no third-party portals. So you start and view patient applications right inside Practice Management Bridge. With Care Now, Pay Later patient financing, providers again are paid up front, and patients can pay over the course of 6 months up to 24 months, and in some cases, even longer. Addressing this barrier can care for results in better patient experience, eases stressful financial conversations for staff, and improves the practice's bottom line. Right? You'll feel confident in filling your schedule knowing that you're going to be paid for the services that you render. Receive the total amount for your patients, receive the total amount up front, like I said earlier, twice a week. If a patient misses a payment plan or defaults for whatever reason, well, guess what? Your practice isn't at risk and is not responsible for chasing those payments. So if you ever had an experience where a patient may have missed a payment and you have to call them 4, 5, 6 times, text message them or whatever other means you may need to get a hold of them, that's off your plate now, right? And our partner, Healthcare Finance Direct, will get them back on track. With a range of payment terms that that will truly fit any budget, you can make it possible for more patients to say yes to the treatment plans that you're presenting to them and not have them walk out of the practice. Because if they don't accept the treatment plan, that's the money walking right out of the door. Now, we've talked a bit about what's in it for the practice. Let's talk a little bit about what's in it for the patient, right? The reason why we all have a practice to begin with. Patient credit scores are never impacted. So just like I said, it's nearly 100% approval. When they apply, there's no hard inquiry because Healthcare Finance Direct is performing a soft credit check. This is going to give the patient and the practice the confidence that they need to present the offer to the patient. Patients will be able to choose from a variety of terms, like we mentioned earlier. There are 6, 12, and even 24-month plans. So this all sounds great, right? We have what benefits for the practice, benefits for the patient, but what's the right time to bring up these conversations? Well, when you have the conversation, right, it's important to bring it up early. But you want to have the conversation throughout the patient's visit, from when they get to the front desk, all the way up to the treatment chair and into the hands of the treatment coordinator. Creating that treatment plan with the treatment coordinator outlines the cost that may be associated with the service. But when you're discussing the cost, be sure to repeat and offer the various ways that patients have to pay, the various ways patients have a way to pay for their service. And keep in mind, we always want to make sure that we're doing what's right for the patient and not prejudging. So I think that we should always make the offer available, whether we think the patient has all the cash on hand to pay for it, or whether we think that the patient possibly couldn't pay for the service at all. We should always be able to say to the patient, yes, we have a plan for you. When you're presenting these options to your patient, various questions may be swirling around in your patient's head when you're talking to them about these different costs. They could be thinking, what if I don't have good credit score or any credit at all? Or I can afford it, but I want a payment plan anyway because I don't want to take the financial hit right now. You can feel confident that even if a patient has a 0 credit score, very little credit history, or bad credit, we can say yes to that patient up to $5,000. Or if that patient doesn't want to deplete their savings and they want to be able to pay for it over time, they can still get the treatment that they need without depleting their savings, all without affecting their credit score. Because there could be that part where they just don't want their credit score to drop, right? They've worked so hard, not only to build up their savings, but to build up their credit score. I know, from when I was 18 applying for my first car to where I am now, it took about 10 years to get to the credit score that I've been striving for. And I think that applies to a lot of our patients that we're seeing in our practices today. So let's look at how Care Now, Pay Later compares to other solutions that you may already be used to. Care Now, Pay Later is unique and it is innovative. Again, as you can see with the orange check marks here on the screen where it says patient approval rate, we're the only nearly 100% approval program without any impact to the credit score because we're doing a soft inquiry. Even if your patient was approved with a competitor, let's say they were 40 or 50 or even 85%, there's a high chance that that patient is only approved for a partial amount if they are even considered what some of these other lenders consider a prime credit score. Getting a partial approval in most cases is just like getting declined. And the other thing that your patients can feel confident in as a key differentiation for this program is that there's an end date for the patient and they know exactly how much they're paying in interest and when this payment plan is going to be paid off. If they're used to using a revolving line of credit like a credit card and they took advantage of a 0% interest offer, there's a high potential for that patient to not pay it off in that an introductory promotional offer of 12 months or 18 months or longer, where that interest that they accrued in the beginning when they opened the account, if they don't pay that off in time, they could be on the hook for all of that interest. So some of you with us today may offer a mixture of payment arrangements at your practice for your patients. Let's take a look at some of the comparisons between in-house financing and third-party financing. So for the folks that are currently doing in-house financing, where maybe you're using a recurring payments program, or they're paying every single time that they come into the practice, however that may be structured, typically you might be using it as a fixed payment schedule, where typically a lot of the staff members need to get involved for these plans. They have to get involved setting up the plan. If a patient misses a payment, they have to get involved for potentially reestablishing that plan, calling the patient to make sure that they're going to be, to find out when they're going to be paying. Sometimes there's a portion of it where they're avoiding the practice altogether. And that could be 2 or 3 months down the road until the patient's ready to start resuming the payment plan, which then has the practice staff potentially reestablishing a new plan, right? This is all time that's significantly wasted trying to collect the payment, where potentially it could be better redirected towards a third party. With third-party financing, you'll notice that there's something similar, right, where you have a fixed schedule of payment arrangements. But with the third-party lender, you're typically paid in full upfront, where if you're financing that in-house, on average, you're waiting for that. If it's a 36-month plan or a 24-month plan, you're waiting for that full 24 months to be fully repaid. Many of the practices that are using, when it comes to third-party financing, you don't have to chase your patients to ensure that they're paying on time. The only thing that you're worried about is making sure that they are picking the right plan for them, delivering the treatment that they need, and then also ensuring that they meet all their follow-up appointments to continue the treatment that they're looking for. So why is Rectangle Health Care Now, Pay Later? So why Rectangle Health, right? Care Now, Pay Later hopefully answered this question for you. If not, let me introduce you to Practice Management Bridge. Well, aside from Care Now, Pay Later, Practice Management Bridge offers a wide variety of capabilities. So in your point of care payments, that enables patients to swipe, dip, or tap their cards, designed with a patient-friendly experience. And they can also use their favorite mobile wallet while feeling confident that the payment is 100% secure without giving out their card information. You also can store the card on file, not only for one-time payments, but for future payments as well. You can go from saying, Steve, how would you like to pay today? To, Steve, how would you like to use your card on file for this payment ending in 1234 and for all future payments? But what about those patients that have balances due, but may want to pay later or are not able to pay today? Well, I'm glad you asked. Patients are always able to make a payment at the point of care, or they're able to call in later with the payment. Keep your practice open 24/7 by accepting payments through online websites. Simply share the payment link or QR code on your next billing statement, or post the link or QR code around the office for easy access so patients can save that link for later. Small businesses that accept 4 or more payment options bring in 7 times more annual revenue than those who accept fewer than 4, according to Forbes. When it comes to text to pay, Forbes also reports that text messages have a 95% read rate within 3 minutes. Text message response rates are also 209% higher than phone calls. So think about how that 209% could affect your practice if you're sending a request for payment through a text message. But last and certainly not least, engaging your patient at every step before they enter the office, during the visit, and after they leave is vital to the longevity of that relationship. Always keep your calendar full with breakpoints, a Rectangle Health company. I want you to envision this. If it's late at night and I'm your patient and I had an emergency come up the next morning, but I have a doctor's appointment with you. Well, I need to make a cancellation And the only way for you to know that I need to cancel it is potentially by me not showing up. So what happens potentially? The doctor shows up into the office at the scheduled time, but that leaves the doctor without a patient to see. Well, streamline that process without ever having to get involved and always have your calendar full. One of the many ways for you to engage your patients is with rave points. Not only can you remind the patients about upcoming appointments, but you can also cut out the registration process with having your patients fill out digital forms prior to arriving at their appointment. Less time filling out paperwork and more time with the doctor. Along with that, customizable messages can reach patients with billing notifications, additional announcements, and more. Think about the announcements. Maybe there's a holiday coming up, and let's say Thanksgiving's right around the corner. And you, instead of just taking Thanksgiving Day, you also want to take the day before Thanksgiving. Sending a customized message to those patients, letting them know that you're going to be closed for that additional day. Or maybe an emergency happened. The office sprinkler system went off, and you need to let all the patients know that you have schedules for that day. Instead of calling them, send them a text message, and they'll be able to know that the office is closed. Now, we went over a lot of information today, and we don't expect you to remember all of it. To learn more about Rectangle Health Solutions, you can use your cell phone if you have it near you, open your camera and scan the QR code, and that'll take you directly to the Rectangle Health webpage with more information about our solutions. And I want to take a moment and say thank you all for lending me your ears today. It's been very exciting to be able to talk through our suite of solutions, especially Care Now, Pay Later, and the benefits not only to the practice, but to the patients. And with that, I'll turn it back over to Frank to talk through some Q&A.
Steve Watson, excellent job. Excellent job, my friend. I would say everyone should applaud, but we wouldn't hear the name. So if you want to applaud on your own, you're welcome to. But in all seriousness, we've had a few folks that have typed in some Q&A, and so if you're up for it, I'm gonna pepper you a little bit with some of these questions. Fair?
Definitely.
So one of the questions is, I guess once it's started, can patients cancel a payment plan? Is that allowed?
Yes, so they do have a way to cancel a payment plan. There are some specific requirements where if they haven't made their first payment already, or if they, let's say for whatever reason, they applied with the provider and the treatment is no longer deemed needed, but they still were approved for that, let's say $3,000. There is a way for the patient to cancel that plan, and they can always reapply or use that plan for something else.
Okay. And so then once a follow-up question to that was, how long will it take once that patient gets their payment plan offers? Like, how long will it take for that to come actually after they apply? So let me ask that the right way. How long will it take for a patient to get their offers after they make that application?
A matter of seconds. So I think the entire process takes maybe from start to finish is less than a minute. So a lot of the information actually comes in pre-populated straight from Practice Management Bridge, which makes the application, that process, that much easier. And as soon as they click the apply button, within 3 seconds or less, the actual offers are presented to the patient. And they'll have a various selections of offers from 0% interest up to potentially 24 months with low down payment offers.
Really are trying to make it as easy as possible, aren't you? A little follow-up behind that one too as well. So we kind of learned now how long the application process takes, but once that original amount, this is a question from Gary, once that original amount is financed, can it be increased?
So if they do need additional funding, they would then potentially apply for another installment contract, so that way they can get the additional funding that they need. Okay,
and so it would still up to that limit, I imagine, as long as there's room in the original. Or
so actually the other unique thing about that, so each payment arrangement that's created there, it's $5,000 per payment arrangement. So effectively, if a patient goes and sees you, Frank, today and they need a root canal, and only
They're in big trouble if they do that,
$3,000.
Steve. I don't
Yes.
know how to do that, Steve. They're in big trouble. No, I'm kidding. Go ahead. Go ahead.
I don't suggest them seeing you either, but just in case.
Yeah. Fair.
Let's say they need $3,000 for that root canal, and they go see another practice that's for the same practice that's enrolled in healthcare in Care Now Pay Later, and they need an additional $2,000. They would apply for that additional $2,000, but it'll be separate agreements, but both are up to $5,000.
Okay, that's excellent. Okay. Tell me this, Jordan asked, what are the merchant fees?
Yeah, so they range anywhere between 5% all the way up to 20% of the requested amount. And that's going to vary based on the actual patient credit score. So that you can imagine the lower risk patients are on that 5% side, or a higher risk patient may be up on that higher 20% side.
Yeah, well, and that makes sense. And it's all based on their, credit and all that kind of stuff, I imagine, right?
But I mean, one thing I think about here, right, is it's even if it's a 20% or 15% or whatever the cost may be, this is potentially a patient that didn't have a treatment plan before. Maybe they, if they used another competitor, that competitor potentially and most likely would have said no to this patient. Which would have left the patient in really a bad space, because now they still can't get the treatment that they need. Where if they are on the lower end of the credit spectrum, right, we're effectively saying yes to that patient so they can get the care that they need.
Yeah, no, and it's funny because sometimes, you have a situation where a person certainly can pay and they want to pay, but, they can't pay that big chunk all at once and that sort of thing. And could be low credit score for any number of reasons, or it could be just a guy like, I used to be self-employed, right? Have a tough time getting credit sometimes just by the nature of it. So this is huge in making, allowing access to this sort of thing. Another quick question from Jordan. Do you have a table that you could share that shows the merchant fees, like on a scale someplace? Do you have something like that?
We do. So we actually have a patient-facing handout. I would have to go, if we want to share it today, I can go and find it. If that's something you want to go through, or we can send it.
Yeah, I would say. Yeah, we'll probably can make a note to share that maybe with everybody after the fact. So okay.
Yeah, we do have a practice-facing one-pager that explains the fees.
Perfect. Last questions come in unless anybody else has some. Again, just open your Q&A, and if you have other questions for Steve, preferably about Care Now Pay Later, but if you mustache wax brands or things like that might be a thing he'll answer as well offline. But come on, Steve, you got to laugh at that. That was mildly amusing.
Mildly amusing.
Mildly. No, but please feel free to ask the questions in there. But real quick, last question from James. He says, is the Lane 700 the only terminal for in-office payments? I'm not sure if we know that.
I think we would have to take that one away just to double check.
Yeah.
So I don't want to give anybody the wrong information on that one.
Fair. Well, that is that's kind of the wrap up there of the questions that folks asked, and thank you guys all for attending and certainly for asking the questions and for tolerating my bad jokes. So I appreciate that too. But scan the QR code if you want more information, and if you have other questions directly for Steve. Steve, is there some way that's best to get in touch with you to answer some of those?
Yeah, if anybody wants to reach out to me, they can actually send me an email directly to product@rectanglehealth.com. I have access to that mailbox, and just when you direct the question, just put in the notes there, question for Steve. I guess I'm in trouble with Frank because he started calling me Steven, so that's okay.
Unless you're in trouble, I'm not going to do it.
But go ahead and direct your question to me, and I'll be happy to answer any questions that you have around Care Now Pay Later.
Fantastic. Hey, thanks so much, Steve, for being with us today and educating us. And thank you all again for joining us. And we look forward to seeing you at the next one. All right, that's it for us.
Have a great day.